Obviously, my background is in healthcare. That's one of the reasons that I opted to go into politics back in 2007, because our healthcare system was broken, and it still needs a lot of medicine to make it better. But just to talk about healthcare briefly, there are really three pillars to healthcare. The first is quality. And I think we have good quality of healthcare in this Commonwealth and in this country. People come from all other countries to receive our healthcare. There's always room for improvement. The second pillar is access. And we want to make sure that all Virginians have access to quality health care. There are a lot of things that we can do to improve on that. The third thing is cost, and it is the cost of health care that is driving the Commonwealth and driving this country to its knees. And so that's what we really need to address. And the first way that we need to address that, and something that is going on and something that I'm really happy to be sitting at the table with, is the evolution from what I would call a quantity-based system. In other words, when I see patients during the day, I'm incentivized by how many patients I see in a day, how many tests I order, how many patients I admit to the hospital. We're shifting from that quantity-based system to an outcome or quality-based system. In other words, how healthy is the population of patients that I take care of? And that's really the way to address cost. And I often ask people, I said, what is the most expensive piece of technology out there that we have now? And most people will say an MRI or a CAT scan, but it's really the provider. I don't have my pen, it's in my pocket, but it's the provider's pen. And it's the tests that we order, again, the people that we admit to the hospital, that kind of thing. So that whole emphasis needs to shift from quantity-based to outcome-based. And then the last thing I would say, and I think we're going to talk about this in another segment, but is coverage. And it's very important when Virginians don't have coverage to health care, there's nowhere for them to receive their care other than the emergency room. And there's a time and place for the emergency room, but it's very expensive. It sometimes can be inefficient, and it's not good for preventive care. So we need to make sure that we have people covered in Virginia. That way costs can be controlled. And one of the things that I have worked on in the last couple years, I actually wrote the language for the budget amendment, is the Medicaid expansion. And I believe we're going to talk about that on another question. But it's very important as an economic driver and as a quality issue for health care in Virginia that we expand Medicaid in Virginia.